Hi, my name is Ian Miller. Today I'm going to demonstrate the proper implementation and irrigation of an NG tube. So first off, even before I'd be in the room, I would check the doctor's orders, check the reasoning for the doctor's orders, for the reason for suction or whatnot. I would gather the supplies needed, and then I would come in, I would introduce myself to the patient. Hi, my name is Ian, I'm your nurse today. I'm about to give you an NG tube, explain the NG tube if they don't understand that or why it's needed, and then identify themselves, see if they're oriented ×3. They don't have a thing, I would just do that. Susie, cool, you were born 1,000 years ago. Now I would first off check the nares, make sure that there's nothing blocking them, no deviated septum, check the back of the pharynx with a pen light, imaginary. We'll then take the NG tube. I've washed my hands before this when I came in the room, and I will measure it by taking the end of it, pasting it to the nose, going back to the ear, and then going down to the sternum. Taking that point, marking that with tape. Now, taking that, put it back here, put on gloves, clean gloves, they don't have to be sterile. I'll take the first 4 inches, take a little bit of lubrication jelly, and lube up the first 4 inches of it. Now, tell them, alright, I'm about to begin the NG tube insertion, just to let them know. Go ahead and start inserting into the nares. If you need to, you can have an assistant, if they're having trouble with it, be beside you with a glass of water with a straw, so that they will be able to sip water. Once you get past those first 4 inches, you can have them lean their head forward a little bit to help ease the passage of the NG tube. Whole time that you're doing it, make sure that it's not coiling up in the back of the throat. Sometimes you might need to make sure that it's going where it needs to. Keep going. Sometimes it's a real pain with these dolls to actually get past this, so I'm going to go ahead and simulate that I made it to the actual portion. But if you need to, when you're doing this on a real person, you could pull back a little bit, allow the patient time to rest, and then continue on until you get to the marked point. Now that it is up to where it's at, I'm going to go ahead and temporarily anchor it to the client's cheek, just so that it won't move. Now, I would simulate that tape stays on. I would have them speak, make sure they can talk. I would threw me off my rhythm. I would then make sure it's not coiled up in the back of the throat with the pen light, and then I would aspirate some of the contents of the stomach, pull it out. I have some amount here, and I could put that in here or in a basin, put it in, test the pH if needed as per hospital orders, put it back, and right here, towel if needed, so that it doesn't get a little messy. Now, when I put it back in, I'm going to listen to the abdomen and try and listen for a swishing sound as you put this in. Alright, I hear it. It means that there's contents that are making their way into the stomach. Next we would actually attach the NG tube properly. So take off this temporary little piece of tape. Where we cross this over itself here. And secure that down with another piece of tape here. And we'll secure of course my safety clip fell down, so perform hand hygiene. Luckily, I have a spare pair of gloves right here. Put these on. Now I'll secure this to patient's gown using a slip knot with a rubber band. This allows the patient some freedom of movement, but they won't actually end up dislodging the NG tube through eating or any other activity. I guess it would be eating with an NG tube for the most part, but now we connect this to suction, and we would label and date the tube, clean up, do some hand hygiene, document. Now we'll go right into irrigation as if this was some time later. Firstly, you need to get a towel because irrigation can be messy, and we're going to disconnect the tube from suction and place it on the towel so it doesn't spill anywhere. And just like earlier, we're going to aspirate some stomach contents, see that it's there, everything looks good. Test for pH if necessary, but just say the doctor doesn't want it. And we're going to listen for swishing sound again. It's present. Now we're going to disconnect the syringe, and this will be filled with normal saline. Bring up about 30 milliliters worth. And we're going to reattach and instill it into the tube and pull back a little bit, and any that we have left over, any amount, we can measure and document. Now we would reattach this back and just clean up after ourselves, remove gloves, perform hand hygiene, and document. And that should be, with a little bumps along the road, the proper implementation and irrigation of an NG tube. Thank you.